I'm a board certified psychiatrist and have helped over 250 PMHNPs and FNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and their clinical confidence to actually help their patients get better and make more money in the process. So in this video, I'm going to be covering how you can build rapport with your patients through telehealth. So this is the specific tips to the telehealth and not the standard stuff that applies to all psychiatric visits, like, pay attention and active listening and all of that. So the first thing we got to start with is that people have a preconceived notion that in-person is better than telehealth. And that, especially old school providers, that absolutely you got to see the patient in person to make the best impression, and you're doing a disservice by going telehealth. And that is simply not the case. I run a full telehealth private practice right now, and I have a patient panel who is very happy to work with me, all telehealth. I've worked in community mental health settings, telehealth, outpatient practices through telehealth. I worked in the psychiatric ED where we would do suicide risk assessments, so pretty sensitive stuff, through telehealth. So the point is that you can definitely provide exceptional psychiatric care through telehealth if you know how to do it right. I also remember there's been some YouTubers and content creators I've followed in the past who have come out with paid programs and things that I've bought all of their stuff and spent thousands of dollars on, from like business coaching and relationship coaching and all that. But the point is that like I built a parasocial relationship with them, aka we built rapport together through telehealth. In fact, you watching this right now, you may be a member of our coaching program, or you're just learning about this stuff as a psychiatric provider from me. But the point is now I'm developing rapport with you and you're learning from me. So telehealth can accomplish all of this stuff if you know how to do it. What it ultimately comes down to, the whole thesis behind this, is you want to provide a stellar experience. So what does this mean? Imagine you go to a restaurant and you're going to some steakhouse, or if you're a vegan, whatever, some vegan steak. Point being, you go to this restaurant, you expect to be sitting down, you expect the waitress, the waiter to be very friendly, you expect your water and your drinks to be handed to you, you expect the food to, of course, taste good. Of course, that's the core product, right? You want the food to taste good, but you want the service as well, you want the atmosphere to look nice, you want it to smell good, you want the feeling of being taken care of, you want the check to be taken care of smoothly, and you just want the overall vibe to be such a positive thing that you're like, wow, that was amazing and I want to go again. And you happily fork over your money to do that. Same thing with telehealth. You want to provide a stellar, exceptional experience. And so how do we do that? So the first thing is it starts with the video link. So you want to make sure that the video link is easy, it's easy for patients to use, it's seamless for them to log in either on their phones or their computers. There's no they don't have to log into something to do that. It's very easy to do. And I say this is because, so one of the jobs I used to work at in this practice, their videos, basically, there would be problems in that the video links would all have to be sent manually. And sometimes my assistant would miss sending them and then the patient would be delayed, or sometimes they had problems logging into it because there was a privacy setting. So point being that it would cause some friction at the beginning that would be a little bit irksome. So you want to make sure that the video link is smooth. Now, the EMR that I use, basically it will auto send the video links to the person's email, to the person's phone. It will send reminders about the appointment as well. So basically it's a lot more seamless experience, and then they just click and then they're in. Similarly in our coaching program as well, right? There's a standard video link. People can click it every month or every week. And then we have our Q&A call, very easy to access, to speak in there. And so similarly, with the video link, you want to understand its features. So if, for example, something I do a lot in my video visits is screen sharing. So I might screen share resources or articles or supplements. I might recommend some content like YouTube videos or my own videos, whatever it might be. I know how to screen share. I also know how to mute and unmute. I know how to change like the background settings so that way, it's a little bit blurred so it's not too distracting. I know how to mute people. So let's say if, like in a group visit, right? Like someone might be talking, then I know how to mute them. I know how to change the paneling so that way if there's like multiple people in a visit, the main focus is the person who's talking. So that way it's not distracted by all the other people. Point being, I know how to share the video link. So point being is just, this might seem so basic, but if you understand how to use its features, you can easily use it and there's not friction during the visit. So that's important. The next thing is the background. So you want to make sure that the background you use is nice, clean, and aesthetic. Some people might use like a standard blank wall. It's whatever, that's neutral, it's serviceable. But if you're able to get a background that has a little bit more aestheticness to it, that just adds to the overall experience that the patient has. Imagine like you go into a steakhouse, it's like, nice and like wooden and, it smells nice in there. And then like whatever, there's candles and it's just like, wow, like this is really nice. That's the experience you have. Versus you could have the exact same food in some like dingy McDonald's, literally the exact same. Imagine the same steak served in a McDonald's. You're not going to have the same experience, even though it's the exact same product. The whole aesthetics, the whole experience matters. So one of my pet peeves is virtual backgrounds. Like I think they just look so tacky. And I would rather if you're using a virtual background, stop, just cut that out. Your face is kind of blurred in with stuff and like it doesn't kind of cut in and out properly, right? I just don't think it looks that good. If you don't just, if whatever your setting is, if the background isn't good, then even neutral is better than a virtual. But if you can put in some effort, like you put in some nice pictures and other things, then that can help. So for example, for my background, you might see here that I have my books here, I have my degree here, right? I have my school trophy here. You can see I'm putting some effort into the aesthetic, the presentation, so that way this looks nice rather than if it's just a plain white background. So that it's important, it matters. So that's that. Then the next thing is the lighting. So many people neglect this and it blows my mind. Like I understand when Zoom was new and things were new, like this is a skill set that you have to adopt, right? And so this is something, of course, as a content creator that I've learned, but lighting is the most important aspect of it by far. If the lighting is not good on your face is just, it feels darker, you see dark circles everywhere. It just makes patients and people not feel as connected to you. Whereas right now I'm filming this, the light that you're seeing is all natural light. That's why it gives this like nice, pleasant glow, is because of the natural light. And so obviously you can't have natural light all the time, but if you can use it, you want to use that. But if you can't, you want to make sure that you have some kind of like ring light or something, right? So I'll show you, the light I have is this. And so it lights up, I attach it to my computer. And so especially when it gets dark, that way the light will come on my face and it lights up my face. And it just helps to give the patient a better experience. Just like if I was just filming this in the dark and you couldn't see, the information is the exact same. However, the presentation matters. So that's lighting. The next is eye contact. So with eye contact, you can see that it feels like I am looking at you right now. Obviously, if you take yourself out, like I'm talking to a camera, but it feels like I'm looking at you, it feels like I'm talking to you because I'm making eye contact. And so the patient needs to feel the same way. And so too often I see that providers will be looking either like at the screen or like a little bit down below. And it's like, it's serviceable, but it's not ideal. Ideally, you want to be looking at the camera, which is tricky because you think that you want to look, because the patient's screen is a little bit, the screen is below the camera. So you feel like you're looking at the patient's face, but in reality, it looks like your eyes are just looking a little bit down. Whereas if you make the conscious effort to look at the camera, not directly at the patient, at the camera, the patient's perception is that you are looking directly at them. So they feel like you are more attuned to them. So that's important. The next thing is being expressive. So studies have found is that people who are more expressive, either in their voice, their hand movements, their just like body kind of freeness overall, they are perceived as more likable and more charismatic. So imagine like now, so you see I'm talking to you, now imagine me just kind of like talking to you like this, or, you know, just kind of like this, right? Or even like this. And like, these are things that I have to catch myself not doing, because I want to be perceived as expressive, as charismatic, as likable to the patient. So point being is that these are skills that you can incorporate into your repertoire. For example, a feedback that I've received in the past is that I'm stone-faced. And so I've had to correct this. Like, people will say that I look bored or uninterested. And this is feedback I received before in the past. And so this is something that I've had to work on, that, okay, make sure I'm smiling a little bit extra than like I normally would, or make sure I'm like really like utilizing my hands or my emotional expression, because a patient might not perceive that, you know, I'm disinterested in real life. They may in the telehealth visit. So that's important. So next thing is your attire. So you want to make sure that you're still looking professional as well there. Even I've succumbed to this, where sometimes I might wear like a t-shirt or something to a patient interview. And because I'm like, oh, whatever, it's telehealth, it doesn't matter. And yes, like the visits have gone over fine, but when I take the effort to wear a collared shirt, for example, like I just feel a little bit more professional, and it reflects, you know, with the patient as well. Even though the patient can only see like up to here, you know, they see that collared shirt, and that it gives just a little bit extra edge to it, right? Like right now I'm wearing scrubs here because I am a doctor. So that's the image that I'm presenting to you is of that. So the attire matters. It matters for the whole presentation. The next thing is that, and I don't think people talk about this enough, is you should get an AI scribe. And the reason I say that is because I've been in situations where, like, as a clinician, I would be typing, and then I would be looking, when I was in person typing and just looking at the person, or if I'm doing telehealth, I'm like looking at the person like, and then like typing stuff. And sometimes I've experienced this on the other end, where I'm talking to someone and they're typing, I hear the keyboard click. I hear the mouse clicking around. You know, they might go back and forth between the EMR window and then like the patient window, right? And so you see that. And then since I started using a scribe in my practice, just AI, what I found is that now I can just like stay on the patient visit and just be more locked in, more focused, and not be worried about the documentation. And that's helped me build a better rapport with the patients, because now I'm not clicking around either. And so also the downside of if you're like clicking around stuff, is that patients can tell. And I never thought this until I remember I used to work with this one kid, like 10, 12-year-old kid. And, he didn't really want to talk to me. Like his mom was making me. And so every time I would talk to him, the kid had glasses on. And then so I'd be on the screen, and then I could see the reflection of my face changing and like the lighting changing. So it would go from like, a little bit darker to like light. And I knew this kid was Googling stuff, or he'd be on some other website. And I could, even though he acted like, okay, he was listening to me and talking to me, I could see that the screen was entirely something different. And so once I saw that, I was like, I think that patients will perceive this as well. So you don't want to be switching around things. You don't want to be trying to document an EMR. You just want to be locked in there, focused with the patient. So that way they feel that you're the most attentive to them that you can be. So yeah, this is my telehealth checklist. You just want to make sure that you do these things, so that way you can build the best rapport that you can with the patient. And yeah, so if you want to learn more real life psychiatry tips like this, like, who else is teaching this stuff? Like, there's nobody online that will teach you this kind of thing. Your schools aren't going to teach you this. No textbook will ever tell you this. Like, this is stuff that you will only learn from this channel and from our PMHNP coaching program, where we had over 250 students go through so far and really master the art of psychiatry and help themselves make more money in the process. So if you want to learn how to do that, as if you're a PMHNP student or graduate or an FNP, best way to do that is to join our coaching academy. And yeah, you can check that out, and I will see you in the next video.